Good morning, good afternoon, colleagues. I hope you can all hear me well. You just signal with a thumbs up. You are all welcome to this important webinar, as second in the series, as we all work towards developing a healthy condom market wherever we are. I think we shall start. I can see more colleagues joining, but we are time constrained, so maybe one more minute and we start. I will be introducing myself, Rosemary Chindiomunda. I'm the Regional HIV/AIDS Technical Advisor, UNFPA, East and Southern Africa region. And I am a condom champion. And I added something else. I'm a satisfied user. So I'm in this with several hats. I think we will start. Colleagues, you are welcome. Feel at home. We are curious to know where you are and where you are coming from. We will not be able to introduce ourselves one by one, so please drop your details in the chat. You can raise your hand along the way if there is something burning, but we shall have one general question and answer session. And please keep the questions, the comments, the inputs also flowing in the chat as we move. We have a fairly packed program, so that's why we are moving. We can move to the next slide. That's why we are moving a little bit fast. I would say that we are looking at the second webinar in a series, and we shall largely focus on segmentation. We've all had discussions around the fact that we are procuring lots of condom that are free to use, the public condom, and sometimes we are not sure whether the targeting is right. And we all know that we have been largely donor dependent for this condom programming through the public sector, and this funding is dwindling quite fast. If you can move to the next slide. And therefore, we are now working globally and at regional country level to understand what exactly that we need to do to focus on total market approach. This is something that was introduced quite a long time ago, but has not taken root. And we want to understand what we need to strengthen so that we can move towards healthy markets across your different contexts, and specifically to understand how we can exploit the Global Fund Grant Cycle 8 opportunity for resource mobilization and transitioning to domestic financing to understand how we can take on this total market approach. So largely looking at the tools that we have in this series that can inform procurement and quantification, condom targeting, what we need on the side of condom program stewardship, looking at the total market in terms of public, social marketing, and commercial sector. Next, please. So as a part of introduction, this webinar specifically focuses on creating a vision for a healthy market, as I mentioned, with specific focus on segmentation. We want to understand how risk and ability to pay can shape national programs to right size them. Are we procuring more than we can use or less? And specifically, can we understand how this basic segmentation can be done and can support sustainable markets. We also identify how demand informs the broader picture on condom use and condom needs. We have talked about the condom needs estimation tool. Some countries have applied it, but we want to understand how we can actually use this tool further to understand market shaping and sustainable condom programming. Next, please. So we have a PACT program, as I mentioned. We will look at our objectives and specifically look at how we can exploit the opportunity to strengthen condom programming under the Global Fund Grant Cycle 8. We acknowledge that Global Fund has actually given a push to condom programming from Cycle 6 through the running Cycle 7. And we now want to understand how this evolves as we transition the markets. We will hear from Mann Global Health around how to create this vision for a sustainable condom market. And then a panel of our experts from 3 countries that are currently supported by Mann Global Health to pilot this particular focus on growing healthy markets from Malawi, Zambia, and Zimbabwe. I hope we have someone from Zambia on board. And then after we've gone through all this, we shall have the question and answer session. But meanwhile, you can highlight your questions in the chat, in the Q&A. They will be responded to, and some we can bring back to the discussion. On that note, I will invite Ayesha. Ayesha works with Genesis Analytics, and she will take us through how this series of webinars are fitting in the broader goals and objectives of the South-South Learning Network, a network of the Global HIV Prevention Coalition, which we all belong to. Over to you, Ayesha.
Thanks so much, Rosemary, and good afternoon, everyone. Thank you so much for joining us today. So yeah, my name is Aisha Ismail, and I lead Insight to Implementation, which is the evidence to action arm of the South-to-South Learning Network. And it's really great to see such a group of colleagues working across sort of condom programming, procurement, and preparing for GC8. So as Rosemary said, the session is part of a 3-part series that's designed to create a space for really practical exchange on how countries are approaching key prevention challenges, particularly in the context of GC8. And really at its core, the SSLN brings together countries to share experiences, to learn from one another, and to apply that learning in a way to strengthen prevention programs. And through Eye to Eye, that also includes supporting countries to translate evidence and data into practical decisions for how programs are designed, resources are allocated, and funding requests are submitted. And so this aligns very closely to help countries navigate GC8 applications. And this is especially important as countries navigate increasing pressure on available resources alongside a continued need to sustain and expand access to prevention. So really to create a very practical challenge on how to allocate limited funding in a way that protects equitable access and also helps build more sustainable systems over time. So today's session is going to focus on one of the most practical tools there is, and that's market segmentation, which is directly relevant for GC8. And so as countries begin to develop their applications, there are sort of important decisions to be made around procurement, resource allocation, and how sustainability is going to be reflected within those proposals. And we're here to support evidence and research and resources for countries as you navigate this. Because without a clear understanding of who is being reached and how condoms are used, there's a risk of misalignment between sort of supply and need. So we're going to spend today talking also about the condom needs estimation tool. And when it's combined with segmentation, this really supports more realistic planning around like stronger justification of procurement decisions within GC8. And it's also here to create a space to prioritize areas that are still often underfunded but are critical. And that includes things such as demand generation, last mile distribution, and market stewardship. So with all of that being said, we hope that today's session will provide really practical approaches that can be directly applied while also creating a space to learn from country experiences on how these decisions are being made in real contexts. So now I'll hand back to the chair to navigate us through the session. Thank you, everybody.
Thanks, Aisha, for that quick background. Indeed, it ushers us to our next speaker, Cara Rodriguez from the Global Fund. She's a program manager on the HIV team and our focal point for condom programming. We've been with Cara from GC6 on condom programming, and we welcome her to take us through what is new on grant cycle 8, and especially as we transition all HIV programming to integrated approaches at country level, what it means in terms of procurements, budgeting, and integrated programming. Over to you, Cara.
Thank you, Rosemary. So, yeah, we were asked to speak about the role of sustainable commodity markets in the Global Fund as part of the HIV prevention response. So, a bit of a donor perspective and how this is relevant as countries are preparing for GC8, particularly around the procurement, the budgeting, and also looking at long-term sustainability. So I'm not bringing slides. In fact, I bring one single slide that I'll show you in a minute. But just to give you a bit of expectations on the Global Fund and Global Fund GC8 going forward. For the Global Fund, even as we see the HIV prevention landscape expanding with the increasing range of prevention innovations becoming available, which is very positive because it supports choice and it's person-centered prevention. The condoms remain and will remain a core HIV prevention intervention for the Global Fund. But it also means that there's a context of growing choice. There's also a context of tightening budgets, as we all know, for HIV prevention or for HIV overall, for HIV prevention, and also for condoms. So in this context of growing choice and tightening budgets, we see that condom programs will be under increasing pressure in many countries. And that's why the term sustainability has been around for some time and is becoming more than ever a central consideration for HIV prevention programming. In this context, and now speaking specifically about condoms, but this is not exclusively to condoms. The total market approach, the TMA, is increasingly relevant for HIV prevention. It's not for us about reducing access or shifting responsibilities away from the public sector, because in fact we see it as a way to increase equity, because it will be the intention is to use limited public resources more strategically, ensuring that free condoms are distributed and are well targeted in that distribution, and also enabling social marketing and commercial actors to play appropriate roles, depending, of course, on the country context. We also see that TMA can help reach younger populations, especially the ones with some ability to pay and an interest in more innovative and appealing products that the private sector can bring. And as Rosemary said, and the objective is to support healthier and more sustainable condom markets, and that we can maintain coverage over time as we see these tensions now in HIV prevention. We can move to the next slide just to, so Global Fund has been investing in condom programs for many cycles now, and is a major investment in condom programming over many years. We can see the increase from GC4 and GC5 from around 70 million to the current cycle in GC7, where we've invested more than 220 million in condoms. And this makes, in fact, condom programming the second largest investment in HIV prevention for the Global Fund. Some of the countries that have high investments in this cycle include Tanzania, Mozambique, Uganda, Malawi, Zambia, South Africa, Zimbabwe, and Nigeria, just to name a few. And we also see that potentially these countries will face increased constraints on condom financing because of changes in external, funding streams and donor priorities. And what we also can see here is that Global Fund has been evolving in its role. So moving from mainly being procuring commodities to looking at the more upstream aspects of the condom programming, including the condom stewardship and management, the last mile distribution, and also aspects of demand creation. Even if we see that a large part of our investment is still on commodities and will continue to be, we also have been paying attention to the other areas of condom programming. And Rosemary mentioned already this. During Grant Cycle 6, there was an initiative implemented with UNFPA and UNAIDS. It was designed as a catalytic investment, and the objective was to support these 4 countries, Malawi, Mozambique, Uganda, and Zambia, to strengthen their condom systems and their markets. So some of these countries, in fact, all of these countries have developed, for instance, the total market approaches plans, and they've started implementing them. This happened in varying degrees depending on each country. From that moment on, our focus during Grant Cycle 7 and will be also in Grant Cycle 8 is to support TMAs and get this right balance between the free public sector distribution while allowing space for social marketing and commercial actors. So I think you are all aware that our GC8 guidance is still being finalized. We hope that it will be up in the website in the next few days. So I'll be a bit generic on the guidance for the moment, but the condoms will remain essential for HIV prevention. They are part of the essentials for HIV prevention, and we'll be guiding, or the guidance will be based on the exercise that was done already in GC7 on the reprioritization. So we will invest in condoms, but we want to invest more efficiently and strategically. And some of the considerations will be to expanding access in high risk, in informal settings, in strengthening last mile delivery, and also some incentive to expanding total market approaches in the countries where appropriate. There will be also some considerations in terms of identifying product and procurement in efficiencies. But really the way we want to look is how to make sustainable and look towards more market shaping activities to have healthier and sustainable condom markets in the future. And I think with that, I will hand over to Chris to take us through the session and learn on practical guidance on how to implement TMA for condoms. Thank you.
Thank you, Cara. And maybe before we go to Chris, I hope colleagues have heard, I've seen many of you are representing governments, ministries of health, national AIDS councils, even some development partners. She mentioned that condom is the second largest investment component on the Global Fund. Rightly so. At our first webinar, we learned more about the role of the condom, especially the cost-effective, cost-saving aspect of it, and the fact that it's critical for all countries to achieve elimination targets. Thank you, Cara, for mentioning the different pieces that we should look forward to. I think I've not had demand creation. We will follow up on that. Next, I will invite Chris. I think we are so fortunate to have Chris being the one leading on this, bringing over 25 years of experience in condom programming, condom marketing from across the continents, if I can say, and specifically a focus on total market approaches. He is going to share with us how to create this vision and taking us through some tools for segmentation. Chris, you are welcome.
Thanks, Rosemary, and thanks, Carla, for setting up the scene for the webinar. And it's great in those 25 years working in condom programming. I've made a lot of friends in fellow condom champions around the world. And so it's great to see many of you on this call. It can feel very lonely at times as we talk about condoms in the midst of many other exciting and new interventions, but we know that condoms are a proven and effective method of preventing HIV. So it's great to be on this call with a fellow group of colleagues. So I'm also working on a team with Mann Global Health and our partner, Africa Health for Business, supporting, as Rosemary said, Malawi, Zimbabwe, and Zambia to the transition to sustainable markets to address some of these challenges that were raised earlier. A lot of what I'm about to present today reflects an evolving learning and collective experience, both in those three countries, as well as in other countries, to determine how we can really turn TMA from concept to reality with specific tools. And this is an approach that I'd like to share with you today. So we've also recently, I should note, published TMA guidance that is now available on the GPC resource library, and we hope is a user-friendly tool to design and implement TMA in your country. This discussion today reflects our new thinking, informed by the support to the three countries, but I just want to reemphasize that the approach is common, but every market will look different in every country based on context, participation of the public and commercial, social marketing sectors, resources that are available. So it's really important to note that TMA is going to look differently in every country. But today, I'll focus on the challenge underpinning condom programs very quickly because I think we're all quite aware of them. So we're well aware of some of the challenges that face condom programming. What's preventing a movement towards a more sustainable condom market, which can maintain or even increase condom use while reducing reliance on donor subsidy, which is our definition of what a sustainable condom market is. We know when we've heard about declining donor funding, this is resulting in inefficient supply. And in particular, we're seeing in many countries concurrent oversupply in some areas and stockouts in others. And that also relates to distribution challenges, not only to the last mile, but even to facilities. And unfortunately, in many countries, non-existent demand generation challenges. As well, we see consistently untapped potential from the sold market. So these current approaches will not sustain condom use under declining funding unless we make some changes and shifts. So this is the example of what we see in Zimbabwe, which was a country that was driven, I should say, a country that has some of the highest reported condom use throughout the region. 15 years ago, that country was driven by social marketing distribution, which accounted for about 70% of all condoms distributed. Over the course of the last 15 years, that has essentially flipped to where public sector distribution now distributes over 90 or accounts for over 90% of supply. That alone could be fine, but what the challenge there is that heavy reliance on free supply means that the country is not very resilient and is susceptible to donor shocks or supply shocks, stockouts, as we saw in the last year when there's hiccups in donor funding. So that is underlying a huge risk to condom markets overall. So a quick review, and we presented this last time, so I'm not going to go into detail into every single step, but overall, and again, this is outlined in our guidance, three critical elements of TMA support. One is understanding and knowing your market, which is including condom use, demand, supply, and gaps underpinning use is critical. And that's really the basic fundamental starting point of every element. The third element is engaging and enabling the sold market. There's a lot of potential both in evolving social marketers and social businesses, as well as the commercial sector, and aligning the sold market, which we describe as those two elements together, with the public sector distribution to support a full total market approach. This creating a vision for a healthy market in the middle, step number 2, is what we're going to talk a bit about in more detail today. Market segmentation is the foundation of a sustainable market and underpins the creation of a vision for a healthy market. So basic market segmentation in this approach can group populations by risk, or who most needs protection or is most vulnerable to HIV, and the ability to pay, or who needs subsidy versus who can purchase. Now, I want to be clear that market segmentation is deployed by both social marketers and the commercial sector in a much more sophisticated way. But if we're looking at holistic national programs, views, and segmentation to inform a TMA, we felt it was important to really bring these down to these 2 critical factors of risk and ability to pay. We'll talk a bit more about how we can do that and how this plays out, but this essentially allows programs to target free countries to those who need them most, create space for the sold market, while ensuring access where and when it is needed. And a key thing that I hope to be repeating to you, if I remember throughout the course of this presentation, is risk determines priority and ability to pay determines subsidy. And those 2 things need to be factored in all of our decisions moving forward. So how we create a vision for a healthy market, we're going to break down into 3 important steps to create that vision. I'm going to go through each one of those steps in greater detail now. But step 1 is, as I said, understanding populations and use, which includes who are our priority populations, who drives condom demand, where is demand unmet, and then quantifying use against need and distribution. And the CNET is a great tool to do that. Number 2 is segmenting risk and ability to pay based on risk and ability to pay. Step 3 is going to be defining the market roles and channels to meet those needs, very fundamentally in free versus the sold market, and looking at basic channels to make that happen. And collectively, we can roll that in together to inform that vision for a healthy market. So step 1, this should say A, estimating condom use versus distribution. So this gets to the role of the CNET, which again is a very powerful tool. It's been developed by UNAIDS. It's been around for some time, and I know that many countries have deployed it. But for those that haven't, it is a powerful approach that estimates actual condom use, estimated use, based on population size and demographics, as well as sexual behaviors or reported use and partner type. It tells us the estimated number of condoms that are actually used, not just distributed. It begins to break down by population segments and sources of supply, that is volume supporting those populations, and helps us highlight where procurement may be misaligned with need. Many countries have designed procurement that is based on prior year's distribution, and that can build up over time and create distortions in the market. So this is an example from a country in sub-Saharan Africa where we see estimated consumption in the green, which was calculated based on estimates of the CNET, versus condoms distributed. And we see condoms distributed exceeds estimated condom use by a factor of 20 to 40 million condoms. That's not insignificant. This isn't the case in every country, but we do see consistent misalignment between condoms that are distributed and estimated condom consumption. In the past, that's been largely okay because we've had resources available to support procurement. But as we move forward with lower funding availability, that's going to be strained. So this is also this idea in step 1 of understanding populations and risk and who drives current condom use. It's important to just highlight again broad trends in use. You see the graph on the right. This is again exceptionally high use in Zimbabwe, but here we see again a large gap between use with men in orange and yellow and women, which trails men in reported use by 15 to 20%. Each country, again, is going to be different, but identifying where those gaps are to drive your strategy is going to be important. That larger graph in the middle of the screen looks at condom needs per priority population, and this is an output of the CNET, which estimates condom used by priority population, including people living with HIV or discordant couples, sex workers, MSM, and then youth, non-regular partners, condoms for FP. If we look at the top section, those are really the highest risk populations, PLHIV, sex workers, and MSM within a country, typically. And then if we look at the bottom factors, youth, non-regular partners, we can begin to balance out individuals that are highest risk with those that have an ability to pay. So why this matters is no single group drives condom use, and so it's helpful to begin to look at and disaggregate use by population. And different populations will require different approaches, and that's where segmentation comes in. So market segmentation, looking at what drives risk and ability to pay here on the left, as I just indicated, risk is related to exposure to HIV and sex acts and vulnerability. Typically, that includes sex workers and men who have sex with men. Some youth may be considered, particularly women and young women, are at very high risk for HIV and may be included in this category, and other vulnerable groups or populations. Again, this will be driven by country context, but we're looking specifically at where risk is in terms of those specific populations. For the general population, those that maybe some of them can afford condoms, we need to look at segmentation to help us understand who might be ability to pay or purchase condoms. So certainly in the highest income quintiles, and there are abilities to estimate monthly consumption through existing studies that are DHS, as well as other studies that focus on user or individual expenditure, which can really help us break down ability to pay by those wealth or income quintiles. In just about every country that we're talking about in sub-Saharan Africa, the richest or the highest income wealth quintile has an ability to pay for condoms. We can begin to break that down by the subpopulation. Quintile 4 looks at a transitional where it might be mixed, some that are looking at, in some countries, that may need access to free condoms, but in many countries, that's not the case, in particular, those countries that are approaching middle income. And finally, quintiles 1 to 3, we may need to be sure that free condoms remain available. So again, this requires looking at the data that's available in your country to apply it to real populations. Step 3 is defining sector roles and channels to support that use. So generally, public sector strengths really rely on a strength, and they're well positioned to serve priority populations through established KP programs, key population programs, including outreach and community networks. We know a lot of that funding is at risk right now, but those programs still exist. Integration in clinical settings is a strength of the public sector, obviously, looking at integration of HIV prevention, treatment, and FP services through clinical services. And these are strengths that can't be ignored, and it's where the national program and the public sector can really excel at. But it's important to also acknowledge the strengths of the sold market, which excels at delivering, at serving general population users at moderate risk, especially when condoms are needed quickly and discreetly outside of the health system. Many populations have preferences and needs that need to be built in where they access condoms and are very much willing and able to pay for those, particularly through retail outlets that are open at later hours than the public sector or have broad reach when and where condoms are needed. So relative strengths of each, but we can play to those relative strengths to inform our distribution and segmentation strategies. So that sustainable market looks at bringing together both factors, both strengths of the public sector and the sold market to work together to achieve national program objectives. So this begins to break this down even further. If we're looking at how we begin to bring segmentation of population, risk, and ability to pay in channels together. So we've got population segment on the left with highest risk populations up top. what their risk factor is, obviously high, because I said, again, they're at the top, and where the source of supply might anticipate it to be. So for sex workers, I could say they're at very high risk of HIV. It's a public health imperative that we ensure that they have access to condoms, and it very well could be that in the national program really prioritizes those through outreach and hotspot delivery to support that free distribution. And that's where that channel comes in. But if we're looking at general populations at high risk, things begin to get a bit more nuanced. So the general population that are having sex with non-regular partners, low income, may very well need, they're at medium risk, but they may very well need free condoms that can be distributed through clinics or community distribution. Whereas higher income populations can begin to access those condoms through shops, kiosks, and pharmacies. Now, these concepts aren't new, and we know that they're being deployed in many countries. But as you begin to think forward about how do we look at segmentation to inform procurement, quantification, and then distribution, it does allow programs that are resource constrained to begin to target in a more effective and specific way free distribution to those that need them. Because again, risk determines ability, and risk determines priority, and ability to pay determines subsidy. So this is begins to get to be an output of a more nuanced view. Again, this is an output from the CNET of estimated condom demand by population segment and source in the future. So this is what countries can be looking at right now for GC8 funding applications of where free condom populations, free condoms should be prioritized for specific populations, and where the role of the sold market. And again, by breaking it down by population and volumes of use driven by population, it becomes clearer of how you can more strategically align source of supply channel to specific populations while creating that space and opportunity for the sold market to serve those that can. So again, in some countries, the red mark here, which is the sold market, it may look much higher for MSM or people living with HIV discordant couples, or for those who are looking for condoms for family planning. But looking at the data and understanding where income levels lie, ability to pay lies, countries can dial in what that appropriate dynamic is for each one of the populations and align strategies to meet those needs over time. This is, again, as a summary. I presented this last time in our webinar of looking at potentially what that vision for a sustainable market is when we begin to aggregate condom use, which we saw in, or volumes needed, as we saw in the prior slide, at a population level, and then begin to align that with actual procurement. So this is the particular case where we're highlighting a country that we estimate has had higher condoms distributed than were actually used as estimated by the CNET. So if we're looking at the bar on the left, in this particular country, we estimated that about 76 million condoms were actually used on an annual basis, versus 118 million that were distributed on a future level. If we are able to, in 5 years' time, begin to dial in and ensure that condoms procured more are come into greater alignment with condoms that are estimated to be used, and then allocate that by ability to pay, and those that can be served by the sold market versus those that require public sector distribution, we can see that there are potentially significant savings that are available. And our hope is that those savings can then be plowed into complementary resources that the national programs may need in this resource-constrained environment. That includes support for last mile distribution, which we know is a major challenge throughout sub-Saharan Africa in particular, as we go through some of these funding shifts particularly with the US government pulling out. We know that demand generation has been neglected. We know that stewardship has been neglected. So if there's an opportunity to shift funding that may have been in the past invested in condoms, we shift that into complementary support to ensure that what condoms are available are targeted and reaching those that actually need them and can be used, then that's a win. Now, again, data needs to inform what that vision for a sustainable market looks like. Consensus-driven approaches are necessary and need, and this is what I hope to get our input from the panel today to determine what are some of these trade-offs and choices that national programs are looking at as they move forward with these decisions. But in summary, this is how we believe that segmentation can better inform national strategies, create that vision for a sustainable market, and is really the critical piece of actually how you implement a total market approach over time. So just to highlight again, some of the total market approach guidance that is now recently available, been made recently available is on the GPC library. The condom needs estimation tool and resources to support that in terms of guidance as well is there, and Mann Global Health and our team working within the region is also a resource as well that we can connect you with tools, guidance to use this and further support moving forward. So thank you very much.
Thank you, Chris, for taking us through the tools that are available. I'm sure there is a detail somewhere, as you've mentioned. Chris mentioned this is a 3-part series. We did the part on Know Your Market, which includes also knowing who is using the condom, whether they are using it. Today we are on the session on creating a vision with a focus on segmentation as a foundation. And please join us again for the last one on engaging and enabling the sold market. Chris highlighted the 4 steps, which we need to keep in our mind as we go into the panel: understanding the population and condom use, your demographics. He mentioned moderate risk, high risk, and so on. Then segmenting by risk and ability to pay. And I picked the 2 points. The risk determines the priority, and ability to pay determines the subsidy. Then defining market roles. Chris, you have a question, interesting question. What is condom marketing already? So now we are defining market roles and channels, both public and sold market. And then finally, you set your vision for a healthy market. I think having worked in condom programming areas for some time, I know how complicated this can be. It requires taking bold steps on the side of governments who, from the broader health perspectives and universal health coverage principles, governments would wish to deliver a free commodity to users. But we also know that we've had issues of efficiencies, and perhaps the bold steps are needed to see whether we can't buy condoms anyway, because I know sometimes the free to use a condom leaks on the sold market and is bought at a fee. So I think we can buy condoms. My question remains, especially we can establish high risk, moderate risk, but colleagues, especially in this region, with generalized epidemics, the issue of low risk is quite important, but very complicated to segment and reach the users the way we wish. And perhaps we will pick that more from the panel session. So I will now take you to the panel of our experts. Ebo, are you on the call? Ebo Living from Zambia. Unfortunately, we couldn't have Rachel. Ebo, please.
Yes.
Okay.
Yes, please, I am. Yeah, sure.
So we have a team of 3 experts. Anne is from the Ministry of Health of Zimbabwe, program coordinator on STIs and HIV and condom programming. You are welcome, Anna. We also have Betha Sato from Malawi. Betha was also on the Condom Strategic Initiative and has walked this journey for some time from the National AIDS Council. And we got Abel Living from UNFPA Zambia. You will pardon us, we had Rachel from ZAMSA, but last minute she couldn't join us. So we have a development partner also bringing in perspectives from Zambia. So we will start with a few questions to set the scene from your perspectives, maybe 2 minutes, since we have saved a few, for us to understand your context, where your countries are now. I will start with Anna. How would you describe the health of your condom market in Zimbabwe right now? What are the biggest issues in terms of, as Chris raised, procurement mismatches, stockouts? How do you get the condom last mile? And what has changed in the previous year, especially considering the fact that we had constraints with the funding streams? Over to you, Anna.
Okay, thank you, Rosemary. So, Zimbabwe was one of the countries that was also affected by the stop work order. It's unfortunate. We were highly reliant on donor funding. So, there were obvious costs that were supporting procurement. We also experienced the disruptions in terms of distribution from the national warehouse to service delivery points, because the support was also looking at the transport, the fuel, and the other logistics to support movement of condoms from the warehouses to service delivery points. So we started experiencing shortages or stockouts in some of the facilities due to the fact that supplies did not reach the destinations in time. So temporary stockouts have been experienced in some of the facilities. Due to also the cut in funding from the US government, Global Fund came to rescue us, and they reprioritized condoms and allocated a budget to fill in the gap that was created through withdrawal from the US government. We have our challenges in that, whilst we are also trying to embrace TMA, we still have challenges in that public sector free distributions. We contribute almost 90% of the market share, whilst the sold market contribution is very, very few. And with the resources that are so few now, so scarce, we really need maybe to rethink and make sure that the sold market is very, very active, and they also push enough volumes so that we reduce dependence on the free condoms.
Thank you. Thank you.
In brief, that's all I can say for now. Yeah.
90% dependence on the free to user, which is almost 100% dependent on external resources. I think Zimbabwe, you are set for creating a vision for a healthy market. Betha, can we hear from you the health of the condom market in Malawi and what is likely happening as we transition, especially to mobilize more resources from Global Fund? Over to you, Betha.
Thank you very much, Rosemary. So for Malawi, the situation is not as different as Anna has already presented the Zimbabwe situation. So prior to 2025, Malawi was on track to attaining our targets for the TMA, which was to achieve at least 25% coming from the spot market and 75% coming from the commercial market. However, there's the funding withdrawal in 2025 from USG, which supported our main social marketing brand, affected our social market, our TMA. So much that now, as at the end of 2025, we are estimating that 88% of our condom needs came from the public sector, with about 12% coming from the sold market, that is both the socially marketed and the commercially marketed condoms. The main breakdown has been especially for the public condoms, has been on the last mile, not necessarily on the stock. We've had stock from Global Fund, but PEPFAR was supporting us with taking the condoms from the facilities to the last mile, and the funding withdrawal, that's where we had the challenges, and we are having to rethink how we are going to do and move forward with last mile distribution going forward. In terms of what has really changed for us, I would say that what has really changed for us significantly is the funding, especially taking the condoms to the last mile for key populations, because this was following a parallel distribution mechanism which was supported by USAID, and with the withdrawal of USAID, this was taken off, and the KPs are having to get the condoms through the normal channels, which for some time posed challenges for us, but also for our adolescent girls and young women who got their condoms in their communities through the DREAMS programs, got affected with the withdrawal of funding. Otherwise, the commodities at the facility level hasn't been really a challenge, because these are supported by Global Fund, which has been consistently with us throughout the time period. So that's a picture of the TMA in Malawi at the moment.
Thank you, Betha. I think we hear from you that the country had actually set the vision for a healthy market, which you were progressing to achieve. You raise an issue about funding to social marketing. You were actually lucky that you still had the social marketing partners for longer than other countries. But I think it is something that Chris may need to speak to, considering that this is a clear gap in the market, and we need to understand how to address this. And you also raise the issue of last mile distribution. We have to get the condoms beyond the health facility, and I'm glad Global Fund is here. But let's quickly, 1 minute, hear from Abel from Zambia.
Right. Thank you so much. Basically, the picture in Zambia is not so different with what is obtaining in Zimbabwe as well as Malawi. We can confirm to say about 70 to 25% of the condoms that are available in Zambia are coming through the public health sector. And then the remainder, that's the 25-30%, is split between those that are socially marketed and those that are sold commercial prices, that is. So, of course, for those that are socially marketed, in the past, we used the maximum brand, which of course was phased out at some point. But now we had DKT that has come on board, and DKT is now marketing the Kiss condoms that are being sold at about 70 cents. So compared to the commercially sold condoms, you can say this price is subsidized. And then in terms of what is not working so well, it's of course like other countries about last mile distribution. So distribution from the central warehouse to regional hubs with support from UNFPA, that I think will perform very well. But then commodities or condoms are not moving from the regional hub to the facilities. We saw from the facilities to the community. So there has been a huge challenge. And then what has changed in the last 12 months, of course, like other countries, it has been about funding. But then the Zambia situation is a bit unique because at the time that the US was pulling out, the government also was slowly increasing its contribution towards the procurement of commodities. So condoms were part of the list of commodities that were procured using domestic resources. So in a way, that part of procurement was not affected deeply. But then Zambia depended on support from US to distribute from the central warehouse to facilities and beyond on US. That is to say, the distribution was affected because after US pulled out, then that support for distribution was deeply, deeply affected. That is why we've also mentioned to say that is where the biggest breakdown has been. Maybe I can end there for now.
Thank you, Abel. I think common challenges across, but you mentioned something interesting, the fact that DKT has come into the market. I do remember a long time ago in Uganda, whenever we were low on the public free to use a condom, the sales would go up for the social marketing side of it. So as I said, we need to be bold and shock these markets if we are to move from where we are. Thanks for the setting the scene. Now we shall go slightly to deep dive into your markets, looking at different aspects for the different countries. And starting with you, Anna, we are looking at market transitions. And Chris went through the processes for segmentation, the trade-offs, the who is most at risk, and so on. So from your perspective, where is this segmentation already happening in Zimbabwe? I would ask whether it is structured or is just happening by market forces. What are the trade-offs you are facing right now, especially as you target the free condom to maintain access, but also use? Do you have any structured approaches for understanding uptake and use vis-a-vis what you are pushing to the users, and what feels most risky about shifting towards a segmented market? Anna, over to you.
Zimbabwe has got a segmented.
Kindly mute if you. Okay.
Zimbabwe is a segmented condom market based on willingness to pay and also based on risk. So we actually have three categories: the high income, the middle income, and low income. And based on these income levels, you realize that those with high income prefer those premium brands of condoms, the likes of Durex and Carex. And then, of course, the middle law, prefer the reasonably priced condoms, Protector Plus, and of course the low income depend mostly on free distributions. We actually channel these condoms through multiple channels, and we also try to ensure that there is no overlap across the segments. The low income, which usually benefits from free distributions, it comprise of the high risk population, sex workers, and some of the MSM, and some young people. They usually access condoms from clinics and from community-based distributors. We have, however, noted that there is leakage of public sector condoms to other channels. And this is so because maybe the condoms, the free distributions are not easily accessible at times when clients need them. So if you go to certain localities, like in Harare, you will actually see vendors selling public sector condoms. We also have our priority populations, which are high risk. This we make sure that they get condoms through the NGOs that are providing services to these clients. When it comes to targeting free condoms versus maintaining access and protecting use, we have noted that we have some tensions in our segmentation. The issue of how to target free condoms to the vulnerable to ensure easy access for those who cannot pay without flooding the market and crowding out the sold market is an issue. And we have to rethink how we can maybe overcome these barriers. And also looking at the shifting donor landscape, we need to be more strict in terms of controlling public sector distributions and make sure that free distributions are more targeted. An example or what we have seen on the ground is we have got big companies and some NGOs who are doing social enterprising, but they are relying on public sector condoms. So we also maybe need to rethink to say who should be targeted with free condoms. What feels most risky about shifting towards a more segmented market, looking at how it can affect the program and also politically, the risk of a more segmented market we anticipate that we can actually maybe get some a bit of a resistance when it comes to then maybe saying we need to reduce the number of condoms. We need to be more targeted when we really don't maybe understand who is at risk, because there are people who are at risk, but they don't perceive themselves to be at risk. We also need to make sure that the data from the sold market is also shared. It's very difficult to get data from the private sector to then really maybe make informed decisions. So if we are talking TMA, we really need to have the three major market players to speak like the same language and make sure that data is shared for us to then maybe be able to plan together and make those informed decisions. That's all I can say from Zimbabwe.
Thank you, Anna. You raise very pertinent issues around the leakages to the sold market, issues around convenience of access, where you position the free condom, issues of balancing to protect use. I did mention that that is a major challenge, especially in generalized epidemics, and the political decision to actually reduce, even if a little bit, on the free to user, which eventually will be determined by our pockets. But the issue of condom program stewardship, partnerships, and getting players in the sold market to actually share their data, which has to be part of the national planning process. I think let's listen to Ebo and see whether first, Betha, on Malawi, focusing on your public sector role in the transition of the subsidy. What is Malawi doing to transition the model? You indicated you had already started but got challenges, and we need to hear from you. I think my experience with Malawi previously, the private sector players did not have a lot of space to engage in the market. Where do you see the opportunity to better target the free condoms? You did mention the KP platforms and AGYW platforms that have experienced disruptions. What is being planned now, and what needs to be true for the sold market to realistically grow? What is missing currently? Betha, 4 or 5 minutes. Thank you.
Thank you, Rosemary. So for Malawi, you're right. There was a time, and I think we've seen a resurgence of that situation where the sold market was outcompeted by the public sector market. So we saw that where we implemented the last mile distribution, the sold market reported drops in their sales in those areas. What has been important for us is to understand from the sold market as well as what is happening. And so I should be quick to mention that one of the most critical challenges for us to support the sold market has been us getting data, especially from the commercial sector. We do get data from the socially marketed sector, but we've been having challenges with the commercial sector. And as you can agree, because there are many, it's been very hard to bring them together and have one weight from them. But what we are doing currently is to work with the Malawi Revenue Authority, which is an agency that deals with collecting data on entry. We are looking into going into an MOU with the MRA to make sure that they give us the data of the condoms that have come in country, so that they help us quantify but also appreciate the trends, so that we quickly respond to any challenges in that sector in real time, not necessarily having to wait for them to tell us when we meet, which is sometimes after 3-6 months or so. So that is one of the things that we are doing to support the sword market to take their space in the condom market. But also, because we have the challenge of the public sector condoms overcrowding, we are going into orienting our implementing partners to target precisely, to make sure that people who are not supposed to receive free condoms and are supposed to buy are really buying. I think I heard from Anna of public sector condoms leaking. We have received reports of the same here in Malawi, which is just showing that there's a mistargeting somewhere, and we are using such reports to inform our targeting orientations to make sure that we close those gaps and deliberately create space for the sword market. For Malawi, also, because we're just coming from conducting a situation analysis of the TMA again, as we go into stabilizing the condom markets initiative, what we have had are two contextual things for Malawi that we are looking at helping the sword market. One is the complexities of importing the condoms, where there are so many middlemen in between. Our commercial condoms are not procured directly from the manufacturers. There are so many middlemen in between, which delays the process and inflates the prices. So we haven't been there yet, but as part of our vision, we are looking at how we can support these commercial players to make sure that they have a link to the manufacturers, so that we take out the issue of middlemen and then bring in some ease in that area. For Malawi contextually especially, we have foreign currency issues, and this is one of the challenges that has stopped or affected the sword market, where they are allocated a certain amount of forex, and when they are considering things to procure, to bring in country, because they are pharmaceutical companies, condoms become the last thing. Their bucket, the complexities, and because we didn't support them really, their profits margin are also not as attractive as the other pharmaceuticals supplies. Now, going into this, we are also looking at supporting. This is what we are going into. We haven't started, I should be quick to mention, but as a vision, we are looking at supporting them to work with the government agency, in this case, the Reserve Bank, so that when they are allocating, there's an allocation for them to procure condoms and to ensure that the condoms have really been procured. So that's some of the things that we are looking at doing to support the commercial sector. I should be quick to mention that one of the opportunities that we have currently in Malawi is that we have recent data from the Malawi Demographic Health Survey, which has told us something different and upcoming regarding condom use, including their ability or willingness to pay in proxy indicators, not necessarily in direct indicators. And we see that as an opportunity to inform our programming. So for example, the MDHS has told us that it's actually young people and even in rural areas that are buying more socially marketed condoms than the young people in urban areas. And even those are the older people who are able to buy. And this is an opportunity for us because we have data. When we were coming up with the previous NSP, the data that we had was old, 2016, but now we have immediate data, which is 2024, just released in 2025 to inform our programming. And this is an opportunity for us to bank on. In addition to that, I mentioned of our social marketing brands being affected, but we are regaining ground now. Why we are regaining ground is because the social marketers that we have are local organizations, local NGOs. And so they have
one minute.
All right. And so they haven't really have to move out of the space because of the funding landscape changes. They are here with us and they are continuing and regaining their ground. And for us, it's easy to work with them because everything for them is managed in country. That's the opportunity. We are looking at targeting young people, especially those in higher learning institutions, but also most importantly as an emerging issue for us, people in emergencies and disasters, which is coming up as an issue every year for us, using PLA distribution for both the SOD and the public sector condoms is one of the initiatives that we are trying to use, because we've tried PLA marketing of Chishango and Care condoms, and it proved to be very efficient as compared to just putting them in the market. So that are some of the things that we are looking at doing as a vision for our TMA. Thank you.
Thank you, Bertha. We are getting the time squeezed. I will quickly go to Ebo. Ebo, you have 2-3 minutes to share more about the supply chain issues in Zambia and what you think needs to be done to address the challenges so that you can align supply to actual use in different places, and specifically what constraints undermine segmentation from your perspective, and the changes that would most likely improve reliability and targeting. 3 minutes from you, Ebo. Thank you.
All right, thank you. So, in trying to highlight what is happening in the supply chain, I'll begin by talking about the quantification process. So, basically, quantification, we use data from facilities, and then this data sometimes is inaccurate, thereby affecting the quality of the output. Ideally, even the condoms that are distributed through the community are supposed to be captured in the system, so that at the time of quantification, we're able to factor in consumption at that level. But then this community distribution or community consumption is never captured because of the disconnect between the health sector and the whole government at those lower levels. So, of course, we are implementing a focused accuracy project where we're trying to look at how well we've been focused in the past. So, from the preliminary results, we are having a picture that shows that we are improving in terms of what we've been quantifying for and what we've been actually using. Last year, we were hoping to be using about 14 million pieces per month. But then in some months, we're using over 14 million. But the number of months we're using way below the 14 million that we quantified. So obviously, this is attributed to the data quality that is used. And then after quantification is done, of course, now we come to procurement. So procurement, of course, is done by different partners, the Global Fund, UNFPA, and the government. So there are times when there are delays in having these shipments delivered at the central warehouse. So obviously, this impacts how soon we have these commodities at the central warehouse, and also how soon they are taken to where they are needed. Then beyond procurement, it's about distribution. As indicated earlier, we've been depending heavily on the support from the US government. So because there's no that support anymore, we are experiencing huge challenges in having commodities where they are needed. Interestingly, we have what we call health center kits. So these health center kits are prepared by the government, and they contain 4 packs of male condoms. Now, because they contain those commodities, the US is unable to support the distribution of those health center kits. So just trying to demonstrate how bad distribution has been affected by this US stock order. But of course, there's been little support from various partners, who others have been using a parallel system. That is to say, they only focus on getting commodities of interest, condoms and other FE commodities, and are taking them purely to their facilities. So of course, we can imagine the challenges that are brought about because of the same. Then when it comes to what we hope to see happening to improve the system, of course, it's about improving data quality. Maybe digitizing the entire process. Right now, we use EMIS to capture data, that is the consumption data. But then, not all facilities have EMIS. And then there's no link between the EMIS that is managed by the government and also the NACMIS that is managed by the National Youth Council. So already there's some data regarding consumption that is lost along the way. I heard you mention to say some condoms that are gotten for free from the government are sometimes sold in these hotspots. So this has also been a challenge right here in Zambia. So at times, condoms that are placed in dispensers, an individual will come and draw quite a lot. And then when it's late in the night, they'll start selling those condoms. Depending on how late it is, they can hike the price for as high as they wish. Sometimes that also causes issues around segmentation. So maybe I can end there for now, unless
Thank
there are
you.
other areas of notes. Yeah.
Thank you, Ebo. Issues of quantification. I hope Zambia will apply the Senate tool as we move forward, but still you need the data. You do mention the quality of the data. For the three countries, I think it's clear that you've been assessing what is happening and you are into discussions around where to take the condom market to. And you are ready to exploit the opportunity of Global Fund, which has specifically indicated that they will be focusing more on transitioning the markets, on building healthy markets. We look up to you, the three countries, to understand, especially with the support from Mann Global Health, how the other countries can take this on. I think as you also plan to share in the chat what you are likely taking to Global Fund, we can receive 2-3 questions before we can move to wrap up our discussion for today. Colleagues have been answering the questions in the chat, but if there is any burning one that you can put up your hand and we quickly go through it. To the panel, to Chris, to Kara, across board. I did have a question on demand creation, which I think has not also come through very well by the panelists. But I do believe that that was the major benefit we are getting from the social marketers. And from even Chris's chat, it's clear that social marketing is really impacted. And I'm throwing out this question as to what can we do? I know Global Fund is not strong on this also. Chris mentioned savings that can apply to other program areas. What can we do with demand creation? But since I'm the chair, I'm waiting to see if there's any other hand, especially if your question in the chat has not been responded to. Am I missing hands? Don't seem to see any. Can someone respond to the issue of what we are going to do with the demand creation as we do the segmentation, as we do the targeting to get the free to use a condom to the very vulnerable? Any, Chris, you want? Yes.
I'll volunteer an answer. Yeah, demand creation is just critical. And I think that was one of the real strengths and positives of social marketing in decades past. But as social marketing has reduced funding, and we know demand generation has suffered. There are lower cost opportunities to support demand generation, digital communication, the Global Fund supported an SI initiative in Zambia and Uganda, Malawi, where they piloted with FHI 360 some interesting digital communications approaches. It has to be budgeted. It's really important that countries are looking at Global Fund, domestic resources, other donors to ensure that adequate demand generation is included in programs. And demand generation, rather than just for condoms, can be also considered within the context of prevention overall. So delivering a basket of messages to address the wide variety of opportunities and needs within a population to holistically opt for the method of their choice. But condoms aren't always fun to use. Availability alone is not enough. Demand generation is super important.
Thank you, Chris. And Clemens has put the link in the chat to a tool that we can use. I think that's what Chris was referring to. Chris made the point about integration, even for demand generation. We are delivering a package, we are enhancing choice. So it's not standalone necessarily, but integrated, especially as we also move to roll out PrEP new products. Any other question? Any other burning question? I think we had a range of issues from the 3 countries. Wilberforce, can you unmute and mention your question? I may not get to it quickly. And I think Amyok, you mentioned you had a question. So Wilberforce and Amyok, we have seconds. Are they unmuted? Well, they are muted. Can someone read for us questions from Wilberforce and Amyok? I couldn't trace them quickly. But meanwhile, I will be... Madonna, is there anything we can do for the voices of our members?
So Karabo will unmute them shortly. Thank you.
Thank you.
Wilberforce and Amia, can you try to speak now?
Hello?
Is that Amyok?
Yeah.
Yes, go ahead.
Yeah. Yeah, hello everyone. Hope everyone
Yes.
is doing well.
Yeah.
Yeah, I've been having issues here. I couldn't find my voice, even where
No,
to
we
record.
We can hear you now. Please ask your question.
Okay, this is great. I've been hearing, I've been going through the presentation. It was really nice. Though I've been kind of busy here. I'm actually in the field, but I was still a bit able to catch up with some of the presentations. So I was just having a question about the condom marketing. I've been hearing what is the impact, what can be done, but can someone tell me more of the condom marketing? Is it more of how to demand creation for the condoms or what? So that's what I'd wanted to understand. Thank you so much.
I think I will send that to Chris. Wilberforce, are you able to ask? Thank you, Amir. I think we are still not getting Wilberforce. Well, he put his question, how best and feasibly can the integration of condom TMA with other TMA strategies such as family planning, HIV testing kits, and PrEP happen in the spirit of promoting integration and combination prevention to build coherent, equitable, and resilient health commodity markets that advance national priorities? I think I'm sending them both to Chris so that we can be quick and conclude our session.
Yeah, thanks. I'll be brief, Rosemary. Typically in marketing, we think of this in terms of the 4 Ps traditionally of marketing, and that includes not just promotion or demand generation, but also what kind of product is available. And that product should ideally be preferred or desired by the user. Place and making sure that condoms are available when and where they're needed is a critical component of that. And the 4th component is affordability or price. And making sure that the user can afford them. So that looks differently in the public sector than the private sector. But if you're looking at sold condoms, those 4 Ps come together holistically to support marketing. In answer to Wilberforce's question, I think maybe one of the few upsides of this existing donor crisis is a shift away from siloed interventions and delivery mechanisms to more of a holistic integrative approach to both not only prevention, but treatment overall. And to the extent that we can include that in primary care systems. In terms of best practice, I think national programs will be figuring this out as we go along, but ensuring that individuals are met where and when they're needed with the holistic care that they're needed, they require. And an individual like a sex worker is going to need a type of care and a number of services and products much different than an MSM versus a young girl or a young boy versus an older man or a client of a sex worker. So just ensuring that options and opportunities are available throughout the system are important. I don't have a magic bullet answer other than continue to integrate.
Thank you. Thank you. We've gone over time already 3 minutes, but thank you, all of you. Thank you to the panelists, to the presenters. We mentioned this was the second session. We will be inviting you for the 3rd session, and we've picked several issues. We are already in the middle of the writing processes. So for Global Fund purposes, we have to use the fact that we are highly dependent on external funding as advocacy to influence political decisions to actually transition the markets. But we have issues of quantification. Let's apply the Senate. We have issues of segmentation. Not very easy, but we have to make an attempt. Data quality was mentioned. Engagement with the partners on the sold market is very critical. We have to create an environment for them to do business, but at the same time, they are now part of the broader partnership and need to move with this. Finally, integration. We may not understand what that means now since we are transitioning from vertical programming in most areas, but we have to do this, especially to understand how we move the condom with the other products for HIV and for sexual reproductive health generally. So I don't know whether there's any word from the South Learning Network, but once again, I thank all of you. I think you've picked a lot that you can take home, and we hope to see you again at the 3rd and last segment of this webinar series. Thank you very much.